If you're a man over 50 and you masturbate, let me ask you something. Have you ever stopped to wonder, is this still healthy for me? Maybe you've had quiet concerns that you might be doing some sort of invisible harm. If that's you, you're not alone. This topic is packed with confusion, old myths, and not nearly enough clear, trustworthy information. It's actually one of the most common but least talked about concerns among older men. And once you dig into the research, it becomes clear why there's so much uncertainty. Studies show that most men over 60 still masturbate, but many are doing so without really knowing how it affects their hormones, their prostate, or even their sexual performance. That's exactly why today's video matters. We're going to have a real science-backed conversation. I'll walk you through 10 surprising benefits of masturbation as you age, followed by 10 important risks to watch out for, so you can make this a safe, healthy part of your life. Let's start on a positive note with the benefits. First up, it helps keep your penis healthy. When you get an erection, blood flows into the spongy tissue of the penis, called the corpora cavernosa. Think of this like a workout. It's a kind of therapy for the tissue, helping it stay elastic and strong, which is key to maintaining solid erections as you age. Second, it's good for your prostate. This one's big. Several large studies, including one from Harvard, found that frequent ejaculation is linked to a lower risk of prostate cancer. The idea is that regular release flushes out harmful substances and keeps the prostate ducts clear. Third, it strengthens your pelvic floor. During orgasm, the pelvic floor muscles, like the pubococcygeus muscle, contract. These muscles are essential for erections, ejaculation, and bladder control. Keeping them active helps you avoid common age-related issues like urinary leakage. Fourth, it lowers your stress hormone levels. Specifically, it reduces cortisol, which is often called the stress hormone. Research shows orgasm causes cortisol to drop significantly. That helps regulate your blood pressure, calm anxiety, and support both mental and heart health. Fifth, it boosts your mood, naturally. Orgasms release dopamine and oxytocin, which are powerful neurochemicals that promote pleasure and connection. It's like your brain's way of giving you a warm hug. That's a huge plus for your emotional well-being. Sixth, it helps you spot health issues early. When you're regularly in touch with your own body, you're more likely to notice changes. That awareness can help detect signs of testicular cancer, penile fibrosis, or other issues early, when treatment is most effective. Seventh, it helps you sleep better. After orgasm, your body releases oxytocin and prolactin while reducing cortisol. This creates a calming effect that makes it easier to drift off into deep, restorative sleep, something many older men struggle with. Eighth, it improves blood flow in your pelvic region, not just to the penis, but to your whole lower body. That circulation supports your bladder, prostate, and surrounding muscles, keeping everything running smoothly. Ninth, it can improve control over ejaculation. If you've ever struggled with premature ejaculation, masturbation gives you a chance to practice. Techniques like stop-start or edging can help you build awareness and gain better control, which translates into better experiences with a partner. And 10th, it keeps your sex drive and brain circuits active. Your brain plays a massive role in arousal. When you regularly fantasize and engage in sexual stimulation, you're keeping those desire pathways alive. That helps maintain libido, even if you don't have a partner. So those are the benefits. But here's the thing. Just like any healthy habit, it all comes down to how you do it. So let's look at the other side of the coin. The 10 potential risks you need to be aware of. First, there's the risk of social isolation. Masturbation becomes a problem when it replaces real human intimacy. It should be a part of your sexual life, not the whole thing. Make sure it's complementing your life, not replacing connection. Second, skin damage. If you're too rough or skip the lube, you can create tiny skin tears. These microlesions can lead to irritation or even infection. The fix? Use a gentle touch and always opt for a good water-based lubricant. Third is desensitization. Doing it the same way every time with the same speed, pressure, or grip can train your brain to respond only to that. This might make it harder to enjoy partnered sex. The solution is variety. Change up your technique, pace, and even the setting. Fourth, it can cover up deeper issues. If you can only get hard while masturbating but not with a partner, that's a red flag. It might be easy to ignore, but this could signal a health issue like heart disease, diabetes, or low testosterone. Don't wait, talk to your doctor. And speaking of deeper issues, let's pause for a second. What I've just shared is the what. But if you're looking for the why, and more importantly, a solution, I've got a resource you need to see. It's a free video that explains a shockingly simple 7-second home remedy that targets the root cause of common male performance problems. This isn't about covering up symptoms, it's about reclaiming your natural stamina and hardness with a 100% natural method. If that sounds like something you'd benefit from, just point your phone's camera at the QR code on your screen, or hit the direct link in the pinned comment below. Watch it after this video. It could make a real difference. Alright, let's finish the list of risks you should know about. Fifth is nerve compression from bad posture. Sitting on hard chairs or slouching while masturbating can press on the pudendal nerve, which may cause pelvic pain or numbness over time. Try lying down or using a soft surface to stay comfortable. Sixth, using it as your only emotional escape. If masturbation is your go-to for dealing with stress or boredom, that's a sign to diversify. Exercise, mindfulness, or even just talking things out with a friend are all important emotional outlets. Seventh, feelings of guilt or shame. If you grew up with strong religious or cultural beliefs against self-pleasure, those emotions may still linger. If that's the case, talking with a sex-positive therapist can be a powerful step toward healing and acceptance. Eighth is pelvic congestion. While too little ejaculation can cause issues, doing it too much, like several times a day, can lead to aching or heaviness in the pelvic area. As with anything, moderation is key. Listen to your body. Ninth, it may affect sperm quality. This only really matters if you're trying to conceive. Ejaculating daily can lower sperm concentration temporarily. If fertility's your goal, experts suggest waiting 2 to 5 days between releases for the best quality. And 10th, disconnection caused by unrealistic porn. If your practice depends heavily on extreme or artificial porn, it can warp your expectations and affect real-life intimacy. Try to balance it with imagination or real memories, something more rooted in reality. So let's wrap this up. Masturbation after 60 isn't inherently good or bad. It's a tool, and like any tool, it's all about how you use it. Done consciously, with care and balance, it can be an incredible part of your overall health plan. I really hope this video gave you some clarity. I'd love to hear your thoughts. What part surprised you the most? Drop a comment below and let's keep the conversation going. And if you found value in this, give it a thumbs up and subscribe for more honest, science-based advice on mature men's health. Tap the notification bell so you don't miss the next one. Stay healthy, and I'll see you in the next video.